Hi, my name is Gokul. We are building EHR on mobile devices, as in iPads, iPhones, and Android phones. We wanted to bring omnipresent electronic devices to doctors' hands. Patient data is highly secure, highly confidential, and is always available to you everywhere. Let me show a quick demo of how SlashDr works. This is the interface to add a patient. We have to press the Add button on the top right corner to add a new patient or search for a patient. The patient can be searched using a name, a phone number, or a patient ID that's printed in a previous prescription. Or you can use this new registration button to add a patient afresh. I'm adding this patient to the queue. Let's now tap the patient to see the summary of the patient. The summary lists all the visits of the patient here, which can be actually looked at in a very detailed way. The previous prescriptions given to the patient at this clinic can be viewed quickly. The nurse can add vitals of the patient. The patient has a high body temperature and it shows in the interface that the patient is having a temperature of 100.1. It indicates in red. The symptoms of the patient is recorded now. The patient has cough for the last 3 weeks, has been wheezing for the last 1 week, and he has a fever for the last 3 days. That's what the patient stated. The patient is a smoker, so it shows in personal history. The patient is a diabetic, it shows in medical history. Now you may look at the detailed history of presenting illness. Cough has been there, the onset has been sudden, and it's more during winter. Fever has been a high grade fever associated with headache. The doctor now does physical examination of the patient. Because the patient is a smoker, he has clubbing and there is enlarged spleen. The doctor does a diagnosis. Doctor thinks it's fever provisionally, so he enters the fever as diagnosis. Fever for evaluation. It's a little uncontrolled. The doctor decides the plan of care now and decides to give an antibiotic for the upper respiratory tract infection. The prescription is now generated. Doctor may remove tablets or medicine that's no longer needed and may add more medicines when necessary. Here I am adding a higher variant of paracetamol thrice daily for 4 days. And when the patient comes and visits next time, I want a CBC done and the patient should visit in 4 days when the course completes. We may preview the prescription now. This is how the prescription looks with generics and all the history conversation that happened between the doctor and the patient, the dosage, the periodicity, and the next visit instructions and an appointment for the next visit. SlashDr assures that the patient data confidentiality is kept intact throughout. Thank you.